Okay, good morning, my dear students. So, आज का topic जो है that is concerned with the clinical pharmacokinetics introduction. So, सबसे पहले while commencing this whole chapter or syllabus of clinical pharmacokinetics, I want to discuss a little bit about the subject overview, that what type of topics we have covered in this discussion or in this lecture series. Right, we have a collaboration or we have a cluster of 7 units. First unit is concerned with the introduction to clinical pharmacokinetics, which is today's topic that we have discussed in the today's lecture, that what is the introductory part of clinical pharmacokinetics. And second unit is concerned with the designing of dosage regimen, in which we will discuss about the nomograms, tabulations, and how we convert the IV dosage to the oral. And similarly, we have another topics that how we concern with the dosage adjustment regimen with the adults, as well as for the pediatrics, and as well as for the geriatrics patients. In the third unit, we have focused on pharmacokinetics of drug interaction. It is quite interesting topic. In this particular unit, we will discuss about how drug interactions are concerned, that which type of drugs interactions are there for, and what type of drugs are recommended for the use of pregnancy, as well as for what type of drug interactions are there, like अगर हमारे पास ड्रग इन्वायरमेंटल इंटरेक्शन की बात की जाए, ड्रग इंटरेक्शन की बात की जाए, right? Similarly, we have a pharmacokinetic parameters which directly impact the drug interactions, like which type of enzymes are there जो कि एक particular drug को metabolize करती है. If we are giving we are inhibiting that enzyme with the help of another drug, then the drug which is metabolized by that enzyme is directly contraindicated for that particular patient. So for example, I am giving a little example here. Lot of medicines are there which is directly metabolized by the cytochrome P450 enzyme. This is one of the enzyme which is used in the phase 1 metabolism for the pharmacokinetic profiling. In this cytochrome P450 enzyme is used for the metabolism, but a patient who is taking grapefruit juices, in that particular case, grapefruit juice is directly acting as an inhibitor of that enzyme. So they directly decrease the activity of cytochrome P450 enzyme. So the drugs which is metabolized by cytochrome P450, उन drugs के साथ हम grape seed fruit का extract या grape seed juices या grapes juices का contraindication apply करते हैं कि इन drugs का इसके साथ एक drug interaction होता है. इस तरीके से कुछ drug interactions के parameter हैं that we will study in the third unit, which is concerned with the pharmacokinetics of drug interactions. जिसमें 3 section आ जाते हैं. First is pharmacokinetic drug interaction. Second one is concerned with the inhibition and induction of drug metabolism, कि कौन सी ऐसी drugs हैं जो कि किसी दूसरी drug को inhibit कर रही है, कौन सी ऐसी drugs हैं किसी enzymes को induce कर रहे हैं, कौन सी ऐसी drugs हैं कोई दूसरे enzyme को synergistic approach के through उसको over activate कर रही हैं. These type of aspects are under the category of third unit. And the third unit, we have a last topic of discussion. It is concerned with the inhibition of biliary excretions. Biliary excretion is totally based upon the liver profiles, that how we can correlate the drug with the liver metabolism, because it's a very major important part of our body, that liver plays a crucial role in the metabolism of xenobiotics. I'm adding a point here, xenobiotics. That xenobiotics is a broad term in which we are using a lot of all the drugs category which going to be towards for the metabolism. After that metabolism, that it will proceed for the excretion. So in the whole idea, in a sum up idea, we can say it is concerned with the ADME, that is called absorption, distribution, metabolism, and excretion. So it's the overall concept of introductory section of clinical pharmacokinetics is covering is included ADME, and in the third unit we conclude inhibition, induction, and biliary excretions, inhibition of biliary excretion, and pharmacokinetic drug interactions. We also emphasize on the, as it is not mentioned in our syllabus, but still we are emphasizing on the some of the aspects and some examples concerned with the drug interactions with the concerned with the pregnant lady, कि कौन सी ऐसी drugs हैं जो pregnancy में नहीं लेनी चाहिए और कौन सी ऐसी drugs हैं जो pregnancy में recommend की जाती हैं as a safer side. So ऐसी चीजें हम जो जितने भी concerned ideas हैं with the drug interactions and inhibition and induction, that all are covered in the third unit. And in the fourth unit, it is a very important unit that it is concerned with the therapeutic drug monitoring. Like we have a numerous list of drugs which is under the category of the therapeutic drug monitoring. बहुत सारी ऐसी drugs हैं जिनकी therapeutic drug monitoring करनी बहुत जरूरी पड़ जाती है, especially for the drugs उनका कोई physical response हमारे पास नहीं आता. Right? For example, if we have some of the drugs like cardiovascular drugs, if I am giving that particular drug to the patient जो hypertension से ग्रस्त है, उस particular patient को अगर हम hypertensive drug देते हैं, then we can easily assess by determining their BP profile. हम blood pressure को check करके हम find out कर सकते हैं whether this drug is working or not. But in the cases, some of the cases are there जिसमें हमारे पास कोई choice ही नहीं है, that we are not able to find a symptomatic thing, that how we can find it out that this drug is useful or this drug giving a responses to particular thing, like in the antibacterials, right? In that cases, we have to measure the toxicity profile, that we have to manage the particular range of that drug कि ये drug किस range के ऊपर अपना therapeutic effect दिखाएगी. And similarly, we have two things here, that one is called minimum inhibitory concentration and another is maximum, and one is the concentration. If we increase that limit, then that particular drug proceed for the toxicity results. So ऐसी चीजें that is concerned with the therapeutic drug monitoring, and this unit, fourth unit, is concerned with approximately 6 parts. First, in this, we will discuss about in the upcoming lectures, we will discuss about the introductory part concerned with the therapeutic drug monitoring. Individual dosage regimen concerned with their factors which affect therapeutic drug monitoring, concerned with genetics, age, sex, weight, if any patient is concerned with the disease, interactions of the drugs. These all are the parameters which is concerned under this particular topic of therapeutic drug monitoring in the second section. In the third section of the fourth unit, we will discuss about the indications of therapeutic drug monitoring and protocols of therapeutic drug monitoring. That what type of protocol should be considered for proceeding for the therapeutic drug monitoring. This is also covered under this chapter or in this particular unit. In the next section, we will consider with the pharmacokinetic and pharmacodynamic correlations in drug therapy, that how we can proceed for this particular region. So in the next section, there is a concerned ideas of the measurements of glomerulus, pharmacokinetic and pharmacodynamic correlations in drug therapy. That how we can consider, how we can correlate pharmacokinetics and pharmacodynamic profiles of drug interaction with respect to TDM. It is also considered in this particular unit. And in the last section, we will cover the various aspects of TDM, that how TDM is concerned with the seizures, how TDM is concerned with the anti-epileptic drugs, how TDM is concerned with the cardiovascular disorders, and how it is concerned with the psychiatric disorders, and how TDM is concerned with the organ transplantation. You can see here, जितने भी अभी तक मैंने disorders के नाम लिए हैं, वो ऐसे disorder हैं, like in the psychotic disorder, depression. We have no any instrument that we can identify that patient is depressed or not. That it is only concerned with the mental behavior. उसका mental behavior कैसा है? Otherwise, we have no any equipment that we can assess that इतना % depression हुआ है. And like we have assessed the temperature, इतना form heat temperature है. That means it is concerned with the hypertemperature. ठीक है? तो वैसे ही इसी concern में depression के case में हम ऐसा नहीं कर सकते. Depression के लिए कोई instrument नहीं है that we can detect the depression कि इस patient में इतना depression हुआ है. No, we have no any such type of equipment. So for that, we proceed for the counseling. This is the major role of the clinical pharmacist. ये major role है counseling का. Depression में हम patient की counseling के बारे में जिक्र करते हैं कि उसका counseling कैसा हो रहा है. On the basis of that, we can easily find it out whether the patient is recovered or not. So for that, एक छोटा सा point यहाँ add करना चाहता हूँ TDM के concern में कि मैंने depressive patient को diazepam दिया. We started from the 0.25 mg of the dose. So that particular dose regimen is carried forward for the one month. But Meanwhile, if we are increasing the dose, as we find it out, there is no any response from the patient side, that there is no any recovery, and we gradually increases the diazepam dose to 25 mg and still proceed for the 50 mg and the 100 mg. So that might be cause a devastating effect to the patient. So in cases के लिए, how we can find it out that which dose of diazepam is toxic for the human body? तो उन चीजों को फाइंड आउट करने के लिए वी विल टेक अ हेल्प ऑफ थेरापेटिक ड्रग मॉनिटरिंग. तो थेरापेटिक ड्रग मॉनिटरिंग को हम करते हैं, वी आर यूजिंग थेरापेटिक ड्रग मॉनिटरिंग सो वी कैन फाइंड इट आउट दैट विच टाइप ऑफ विंडो, दैट दिस इज द टॉक्सिसिटी रेंज एंड दिस इज द मिनिमम रेंज, और इसके बीच में देयर इज अ थेरापेटिक विंडो. So we will manage our dosage regimen in between this limit. So that is called therapeutic window. तो इस रेंज में हमें अपना रखना है डोजेज रेजिमेंट को, उस डोजेज रेजिमेंट की स्टडी करो, और with the help of some analysis, with the help of some chemical parameters or biochemical assessments, we can easily find it out that how we can assess the therapeutic drug monitoring. This is overall concept of fourth unit, that is concerned with the therapeutic drug monitoring. In the fifth unit, we will concern with the dosage adjustment in the renal and hepatic diseases, which is concerned again with a very lengthy unit. It contains a very important aspects of renal. ठीक है, while commencing towards the renal disorder, हम सबसे पहले इस यूनिट को जब भी शुरू करेंगे, then we will definitely have a look on the little aspects of the kidney and the physiological aspects and the anatomy aspects of the kidney, that what is the anatomy and what is the physiology of the kidney, and then we will shift towards this particular unit, which is concerned with the renal impairment, pharmacokinetic consideration. This is the second portion of this particular unit. And third portion is the general approaches of the renal adjustment for a patient who is suffering from renal diseases. उन patients में हमें dosage regimens को किस तरीके से maintain करके रखना है, इसके बारे में हम इस particular unit में discuss करेंगे. In the next concern, that is very easy topic, and हम शुरू से 4 साल हो चुके हैं हमें. Now we are in the 5th year. तो glomerulus filtration rate के बारे में हम पढ़ते आ रहे हैं. एक particular session हम glomerulus filtration rate के ऊपर भी रखेंगे, that how glomerulus filtration rate is affecting our patients and how it is concerned with the renal disorders, and how we can consider GFR and renal disease patients while prescribing drugs to that particular patients. So this type of aspects is discussed in this unit. In the next, in the same 5th unit, we have another topic that is called dosage adjustment for the uremic patients. As per Google, as per Kadzeng, and as per KD Tripathi, that uremic patients and renal disease patients are somewhat same. But we categorize in the same patients, like in the some books it is recommended that uremic patient might be concerned with some urine related infections, right? That the infection which is not proceed towards the kidney, only concerned with the urine. So that sometime we will consider that patients as a uremic patients, but the condition which is concerned with the clinical pharmacokinetic profiles of renal and the hepatic diseases, it is purely based upon the kidney and the liver itself. So next is the second last topic of the 5th unit that we will, in the upcoming lectures, we will discuss about the extracorporeal removal of drugs. Very important topic. Little bit I'm giving a overview of that particular topic, that like dialysis. Dialysis is a process concerned with the purification of blood, or we can say it's a filtration process of blood. जिनमें kidneys खराब हो जाती हैं, उन patients में हम dialysis करवाते हैं. But extracorporeal removal of drugs का मतलब है a patients जिनमें kidney खराब हुई है, उन केसेस में अगर पेशेंट कोई प्रोलॉन्ग डिसऑर्डर से पर्टिकुलर सफर कर रहे हैं, उस केस में हमारा प्रोलॉन्ग ड्यूरेशन का रेजिमेंट डोजेज रेजिमेंट चलता है. इन दैट केसेस वी हैव अ प्रोसेस ऑफ एक्स्ट्राकोरियल रिमूवल ऑफ ड्रग. तो अगर पेशेंट किडनी कॉम्प्रोमाइज है, इन दैट केस वी विल प्रोसीड फॉर द एक्स्ट्राकोरियल. उसमें डायलिसिस जैसी कुछ टर्म्स यूज की जाती हैं, डायलिसिस जैसी कुछ कैटेगरीज यूज की जाती हैं फॉर द प्यूरिफिकेशन ऑफ ब्लड. उसमें हम ब्लड में से ड्रग को रिमूव कर रहे हैं. वी आर रिमूविंग द टॉक्सिक कंटेंट ऑफ द ड्रग्स फ्रॉम द ब्लड. And this is another approach for the extracorporeal removal of the drugs. And the last topic of the 5th unit is concerned with the effect of hepatic diseases on pharmacokinetic profiles. Effect of hepatic diseases. That what type of hepatic disorders? Numerous hepatic disorders we have, like we have NAFLD, we have FLD, we have liver injury, we have diabetic liver injury, we concerned with the hepatitis. These all are the number of the diseases which is very devastating for the present situations. Because why I'm perceiving for the present situation nowadays, our dietary habits are very poor. हर कोई कैंडिडेट जो है पिज्जा बर्गर्स एंड हेल्दी फूड की जगह ये फैट प्रोडक्ट्स की तरफ बढ़ रहे हैं. Similarly, we have another choice of high fructose compounds like beverages, artificial drinks जिसमें ज्यादा अमाउंट फ्रक्टोज की होती है. ऐसे कंटेंट्स जो है that ultimately leads towards the liver injury, because they are concerned with the fat disbalance. If fat disbalance is there, then we directly concerned with the liver disbalance or liver metabolism is disturbed in that particular patient. So उनके patients में भी हमारे पास कुछ hepatic diseases आ जाती हैं. और ऐसे patients में क्योंकि liver is a major organ जो metabolism करता है, और सारा metabolism कोई भी xenobiotics है, कोई भी drug हम दे रहे हैं, that is directly or indirectly concerned with the metabolism. In that particular major organ, that is liver, is playing a very crucial role for the metabolism. If liver is compromised, then you can see that what happened in the patient's body. Liver compromise हो चुका है, drug जो हम दे रहे हैं वो metabolize नहीं हो पा रही. In that cases, we have to take a very keen observation or very keen precautions that what type of drug we recommend for that particular patient who is hepatic compromised. So this is overall concerned with the 5th unit, and the 6th, that is second last unit of our syllabus, that is concerned with the population pharmacokinetics. In this little bit concerned with the mathematics, that we will discuss about the Bayesian's theory. Bayesian's theory अपने आप में एक probability based theory है, but which is directly concerned with the probability. और एक concept हो कि मैं एक अंदाजा लगा रहा हूँ कि इतने पेशेंट्स मेरे पास ब्लड प्रेशर के आएंगे, और आने वाले समय में एक इतना पेशेंट जो है ये मेरे पास एक एपिडेमोलॉजिकल स्टडीज या फिर एक डॉक्टर प्रेडिक्शन लगा दे विदाउट सीइंग द बायोकेमिकल पैरामीटर, ओनली ऑन द बेसिस ऑफ सिम्टम्स. दैट डॉक्टर गिव्स अ प्रेडिक्शन कि हाँ, on the basis of symptoms that patient might be suffering from heart attack problems, might be that particular patient is suffering from angina. Then in that cases we compare the prediction and the actual results. This type of analysis is covered in the Bayesian's theory, and it is also concerned with the population pharmacokinetics. And in the same category of the unit, we will also discuss about the adaptive dosage regimens and doses with the feedback system, that what type of feedback system we have to consider while designing adaptive methods. And in the last section, we will concern with the population pharmacokinetic studies. Population pharmacokinetics directly concerned with the epidemiological studies, surveys, and it is concerned with the that prevalence factor, that what type of prevalence is there, that this Punjab region is concerned, like we are giving an example of Bathinda, that Bathinda is a particularly region which is mostly concerned with the cancer patients. So this type of population pharmacokinetic studies will be covered in this particular session of unit 6. And last unit, that is concerned with the pharmacogenetics. It's a very important unit and one of my favorite topics, that it is concerned with the genetics and pharmacogenetics. In this, we will cover that what type of mutations, what type of addition, deletions, inversions, that how genetic is concerned with the dosage regimens, that how we can correlate the genetics with the patient's profile. आजकल एक बड़ा अच्छा प्रोजेक्ट आ रहा है, that is concerned with the human genome projects. HGP भी बोला जाता है इसको, HGP. इसमें काफी सारी कंट्रीज हैं जो लगी हुई हैं which directly concerned with the gene profiling of the human body. मगर ये अब I think 2012 में I think ये complete हो चुका है. जो अभी तक का जितना भी जीनोमिक और डेटा है ह्यूमन बॉडी का, वो सारा HGP में डेटा सेव हो चुका है. Now we can easily assess that what type of genetic profiles is concerned with the liver patient, what type of genetic profile is concerned with the heart related patients. हमें पूरा genetic profile पता लगेगा, एक normal individual का और एक disease patient का. So we can easily predict that whether this patient in the future, upcoming future, क्या इसको ये disorder हो सकता है. Because we, for example, अगर एक example दूँ, मेरे में diabetes के भी genes हैं, मेरे अंदर एक मेटाबॉलिक डिसऑर्डर के जीन्स हैं, बट दैट आर इन द रिसेसिव स्टेट, नॉट इन द डोमिनेंट स्टेट. This is the major problem, that we have some genetic makeup. उन disease के genetic makeups और genetic sequencing हमारे अंदर है, but is it over expressed or down regulated? That is the major aspect. That how we can check it out कि कौन सा genetic profile जो है मेरे बॉडी में, या कौन सा ऐसा जीन एक्सप्रेशन है जो कि ओवर एक्सप्रेस है या डाउन रेगुलेटेड है, उस बेसिस पे वी कैन प्रोसीड फॉर द डिसऑर्डर प्रोफाइल. सो ये पर्टिकुलर कंसेप्ट जो 7th यूनिट का फर्स्ट यूनिट में आता है, दैट इज कंसर्न विद द ड्रग मेटाबॉलिज्म, how we can correlate this genetic profiles with cytochrome P450 enzyme, metabolic disorders. These are aspects that are categorized or discussed in this particular unit, that is called 7th unit. And the 7th unit का जो second portion है, that is dedicated towards the drug transportation and drug targeting. That what type of drug targets and what type of genetic polymorphism is concerned with the transportation and targets, right? So genetic polymorphism is also discussed in this particular session. And in the last section, we'll cover pharmacogenetics and pharmacokinetics and dynamics profiles and correlational studies with dynamics, kinetics with respect to pharmacogenetics. This is particularly emphasized in this particular unit of the 7th unit. So this is our overall discussion, that this particular concept of units we have in this particular syllabus. हमारे इस particular syllabus में हमारे ये कुछ aspects हैं जिसमें हम discussion करेंगे genetics की, dynamics की, clinical kinetics की, drug targeting, dosage regimens, therapeutic drug monitoring, pharmacokinetic profiles, metabolism, hepato-related problems, renal-related problems, and how they can correlate with the dosage regimen, how we can adjust the dosage regimen, how we can convert IV dosage regimen to the oral dosage. And we have a very broad category of discussion under the category of nomograms. We have a broad category of discussion under the section of tabulation, that how we can use tabulation and nomograms to calculate the dosage regimens on the basis of their age, sex, and their weight. So these type of things are there. Similarly, we have a lot of formulas as there, which is useful for converting dosage regimen for geriatrics as well as for the pediatric patients. So this is overall overview that what is in this particular syllabus. इस syllabus में हम ये 7 units को cover करेंगे, and we try to mop up within 2 months. So we will proceed for the next session of the next teacher. तो हम इसको 2 या 3 महीने के अंदर इसको पूरे syllabus को cover करने की कोशिश करेंगे. And it is another request to you. अगर session close होता है आपसे यहाँ पर, तो दोबारा से मेरे साथ ज्वाइन कर लेना, क्योंकि जूम जो है एक बार बंद हो जाता है, फिर दोबारा से रीएक्टिवेट करना पड़ता है. So it's a request to you. If session is over automatically, then you can again click on that particular link and you can rejoin on this particular session. So today's session is dedicated towards the clinical pharmacokinetic. It is the first unit of our discussion. हमारा first unit है dedicated towards the clinical pharmacokinetics and pharmacodynamics. While processing towards, or while commencing my lecture towards clinical pharmacokinetics, first of all, I want to give a little introduction about pharmacology. So pharmacology क्या है? What is pharmacology and how we can correlate with the pharmacokinetics and pharmacodynamics? So remember, when we are concerned with the pharmacology, हमें 2 चीजें बहुत ध्यान से पढ़नी होती है, that is physiology and pathophysiology. And in every lecture, whenever I'm through a lecture on pharmacology, and I'm starting this lecture on this particular quote, that we have to convert pathophysiological state to the physiological state. That is called pharmacology. That we are converting pathological state to the physiological state. This is called physiology. This is called pharmacology. In between this, we are using therapeutic management. Now, this this therapeutic management is not only concerned with the drugs. We have 2 types of sections. Because it is clinical pharmacokinetics, I am again and again emphasizing on this particular topic, that it is not only concerned with the pharmacology. It is broadly classified into 2 categories. That one is called non-pharmacological parameters, and other is called pharmacological parameters. In the non-pharmacological section, we have numerous choices of the regimens, like we have yoga, we have dietary habits, we have exercise regimens, we have dietary interventions. These all are under the category of non-pharmacological. But when we concern with the pharmacological categories, then in this particular session, pharmacology is directly concerned with the drugs regimen, or it is concerned with the medicines or therapeutically active components. So these two categories is concerned with the clinical pharmacokinetics and how we can shift towards this particular regimens towards the patient's need. किस तरीके से उसको patient की तरफ लेके जाना है, उस particular discussion का part है ये particular unit. So as I'm already discussed, that we have to convert pathological state to the physiological state, that with the help of some doses regimens, with the help of some drugs, that we will converting this particular stage to physiology. So while we are converting the stage from the pathology to the physiology, I have two terms here. That is, one is called PK and other is termed as PD. Pharmacokinetics and pharmacodynamics. So these two aspects is concerned with the pharmacokinetics and dynamics. The collaboration of these two is equivalent to pharmacology. So it is a collaboration of these two things, kinetics and dynamics. Now, what dynamics, as per the K.D. Tripaঠি's examples or K.D. Tripaఠi definition, that what the drug does to the body, that is dynamics, and what body does to the drug is termed as kinetics. And that's why body हमारा क्या response दे रही है, मेरे अंदर body ने क्या हलचल की, because drug is xenobiotic. Drug is not meant for our body. हम drug को as a foreign particle insert कर रहे हैं, उसके खिलाफ body क्या क्या parameters लेती है, that is concerned with the pharmacology. क्योंकि drug हमें एक normal position में नहीं दी जाती. We are converting pathophysiology to physiology. तो उस session में body क्या क्या response देती है, that is considered the kinetic study. That's why a broad terms of classification is there, that we defined as kinetic studies in the 3-4 sessions, that is called A, D, M, E. That is absorption, distribution, metabolism, and excretion. Some books also recommend that elimination and excretion is same thing, but in some of the other books, and even though in the when we take like the help of Google, then we have find it out that there is a still difference between elimination and excretion. There's a quite difference between elimination and excretion. The concern with the excretion is concerned with the fecal matter waste, and elimination is concerned with the liquid matter, that is concerned with the urine and sweating like material is concerned with the elimination and excretion. So absorption, distribution, metabolism, and excretion. Now please have a look on this, that why there is a need to design two things, that is phase 1 and phase 2. Metabolism. We have a broad category of examples of metabolism. That metabolism is classified into two categories, that is catabolism and anabolism. That what is the need of phase 1 and phase 2 metabolism, because this is man-made creations. ये हमने स्टडी की कि फेज 1 है, फेज 2 है, ये ड्रग इस एंजाइम से मेटाबोलाइज होगी, ये ड्रग इस एंजाइम से मेटाबोलाइज होगी, but the natural phenomena is totally based upon anabolism and catabolism. One is destructive phase, another is constructive phase. This is natural. But when abnormality is there, when pathophysiological state is there, in that case, we take a help of phase 1 and phase 2 reactions, that is metabolic reactions. Phase 1 and phase 2 reactions की help लेते हैं to understand that what type of drug is metabolized with what type of enzymes. We have phase 1 reactions, oxidation, reduction, hydrolysis. And similarly, when we categorize phase 2 reactions, we have a numerous list. We have glucouridination, we have sulfonation, we have acetylation. These type of categories fall under the category of phase 2 reaction. And some little effects are also emphasized nowadays, which is concerned with the microbiota concentrations. That how we can correlate this metabolic factors with the microbiota. हम माइक्रोबायोटा को किस तरीके से कोरिलेट कर सकते हैं विद द मेटाबॉलिज्म, because we have in our body we have useful microbiota which directly play a role for the metabolism. In the next lecture I will definitely have a focus on this particular lecture, that how xenobiotics are concerned with the microbiotas. तो माइक्रोबायोटा किस तरीके से रोल प्ले करते हैं, ये नेक्स्ट सेशन के लिए मैं बचा के रखता हूँ. नेक्स्ट सेशन में हम इसको जरूर डिस्कस करेंगे कि माइक्रोबायोटा का क्या रोल होता है. Similarly, in this particular session, that clinical pharmacokinetic, that what exactly is concerned as clinical pharmacokinetic, and proceed for the next slide. That why study is required for the concern with the studies of pharmacokinetics and pharmacodynamics. We have a list of 2 to 3 points here. So first point is concerned with the individualization of patient's drug therapy. It is totally different from pharmacology, because pharmacology हम पढ़ चुके हैं बहुत अच्छी तरीके से. What is ADME? What is? I am giving now over through how we can correlate with the dynamics and kinetics. How we can correlate. These are some of the points of. I think it is not visualized to you, but I am dictating. I am particularly reciting these points for you. Right. The first point is concerned with the individual patient's drug therapy. Second, individual means I am different, you are different from your own perspectives. I have a different enzyme system, you have different, same species are there, but working environment is different. That individual to individual dosage variations are there. So that type of studies are under the category of clinical pharmacokinetics. So this particular individual patient drug therapy, monitoring medications with a narrow therapeutic drug monitoring, and that is concerned with the therapeutic drug monitoring. Therapeutic narrow therapeutic index. जिन ड्रग्स का narrow therapeutic index है, उन ड्रग्स को हम स्पेशली एम्फसाइज करते हैं. That we have to find it out. And next category, decrease the risk of adverse effects. This is another approach of pharmacology. It's a very beautiful subject. That we have to focus on the pharmacological profiles, because we are emphasizing on ADR and ADE. Adverse drug reaction and adverse drug events. There is a difference between adverse drug reactions and adverse drug events. How it is differentiated from itself. Adverse drug reaction, that is totally based upon the drug itself. But adverse drug events is not totally, or we can say never, not always, it is concerned with the drug itself. For example, मैंने कोई drug ले ली और वो ड्रग से पहले ही मेरी बॉडी में कुछ प्रॉब्लम्स चल रही, and that leads to some complications and side effects, and I have a breakthrough